Well, good morning to everybody on the call, and thank you for joining us. I am Liz Fraser. I'm the Policy Director for the Connecticut Association for Human Services cause, and I will be facilitating this morning's press conference. Sponsors for this event include CAUSE and the Connecticut Early Childhood Alliance with Merrill Gay, and the SEIU with Ava Bermudez, which is representing family early care home providers. Additionally, we have many co-sponsors that I believe are going to be put up on the screen shortly. Again, if you are part of the press and would like to record this Zoom, we need to give you permission to do that. So please, in the chat, just ask and identify yourself and ask that you be allowed permission to record. For everybody else on the call, we are recording this ourselves. It just takes a little while to download it all, and we will put it on the listserv when it's done. We will have time for questions. However, as we hear from our panelists, if you have a question and you want to make sure it is covered, please put it in the chat and we will make sure to get to it. So, we are here today to bring attention to the national child care crisis that is directly impacting Connecticut and threatens to disrupt the reopening of our Connecticut economy and our schools. And first, we would like to thank the Office of Early Childhood for their hard work, their long hours, and responsiveness to the early childhood community. They have used all of the CARES Act in an effort to really keep us going for a few months. However, a really very real child care crisis is looming, imminent, and they will not be able to solve this without substantial help. Child care is an essential part of our economic infrastructure that prepares children for the future and enables parents to work, and all the while employing a large workforce. Childcare also supports our school systems, providing before and after school care, as well as supporting teachers with young children. However, years of underfunding and the expense of providing a quality early care and learning environment have created a precarious childcare infrastructure. And now, COVID-19 has pushed this industry over the edge, and it is on the verge of collapse. The situation is dire, and you will be hearing about that later, but in Connecticut, 40 to 50% of providers are still closed, with some child care providers shuttered for good. And others don't know if they will be able to open, or if they will be able to open but not sustain this environment. This infographic is a 2019 infographic prepared by the Center for Economic Development, and it shows the economic impact of childcare in Connecticut before COVID. Please note that the economic impact numbers represent revenue from childcare and supporting businesses, not the earnings from the working parents who are able to work and contribute to our Connecticut economy because of childcare. The COVID environment is adding to the previously precarious childcare business environment and putting a large portion of our economy in Connecticut at risk. This morning, we will give you some context of the problem from several organizations and hear from 4 early care and education providers representing the diverse types of care offered in Connecticut. We are also grateful to have members of our congressional delegation who have graciously joined us this morning. Would like to welcome Senator Blumenthal, who is a staunch supporter of early care and education and of parents. And we are happy to welcome Representative Rosa DeLauro, who has been a champion for children and families in Connecticut and throughout our country. We are so pleased to have you both here today, and you will have some time for comments at the end. So what I would like to do now is just to keep this going and introduce Karen Rainville of CAEYC, the Connecticut Association for the Education of Young Children, who has information on the impact of COVID on our early care and education providers.
Thanks, Liz. I'm happy to be here. Meryl, can you go to the next slide? Perfect. So childcare is in a fight to survive. Right now, as Liz said, we are approaching a catastrophic situation. Recently, CAEYC conducted a survey of just over 5,000 childcare providers, and the findings are frightening. And so as you can see, based on the programs that were surveyed, 2 out of 5 of the programs, half of which are minority-owned businesses, are certain that they will close permanently without public assistance. 18% nationally of childcare centers and 9% of family childcare homes still remain closed. And of those who are open, 86% are serving fewer children than they were prior to the pandemic. And so programs right now are forced to make a choice of impossible choices between health and safety and quality and financial solvency. Meryl, can you go to the Connecticut statistics? So what does that look like in Connecticut? So right now, 47% of programs are open. So that equates to 604 center-based, 1,023 family childcare homes, and 14 group homes. Of those that are open, they're only operating at 41% capacity. And so if you think about capacity-wise, we're already at less than 50% of our capacity, and of those, they're operating at less than 50% of their capacity. And so what does that mean going forward? If the numbers are correct, NAEYC predicts that 63% of programs across all settings expect to be operating at or below 80% of enrollment past the end of this summer. And so if you look at the bottom of the program closure chart, those are the projections if there are not additional funds to support these programs. This is what our nation can expect to happen between now and the next year. 7% additional will be closed in July, 22% more will be closed in September, 23% more closed in December, and yet 29% more closed in June. And so by the end of June of 2021, only 18% of childcare programs expect that they will survive longer than a year if something doesn't change. We are at a critical place in this industry. We need to ask ourselves a question, and we need to ask our representatives the questions. Are we going to continue to underfund and undervalue a system that is really the backbone to the rest of the economy? Or are we going to invest and make the investments that recognize the essential nature of childcare? Thanks.
Well, and then the last item there, Karen.
Connecticut data. So as of right now, we know that 18 programs in Connecticut have closed permanently, and we expect that number to increase.
Well, thank you very much for reporting that for us, Karen. We know these numbers are dire, and we need to do something about it. However, numbers are great, but stories from the field are going to give you some context for the fear, the worry, and the climate in our early childhood field. And today, first, we have many different types of providers in Connecticut. We have family care, we have tuition-based preschool, which is based on parent fees mostly. And we also have some that are partially publicly funded. And we're going to hear from all of those today. First, we have a family child care provider, Tanel Smalls, and she is from New Haven. And you're welcome to start.
Thank you very much, Liz. Can everyone hear me?
Yes. Yeah, great.
Thank you. Good morning, Senator Blumenthal. Good morning, Representative DeLauro. Good morning, leaders. And most of all, I would like to say good morning to my fellow educators and my fellow colleagues. As Liz mentioned, I am Tanel Smalls. I'm a licensed in-home child care provider and also an All Our Kin Board of Directors member for family child care providers in the state of Connecticut. And I am also a strong supporter and member of Circle, which is directed by Georgia Goldburn, who's one of our speakers, and her co-host, co-colleague, Tammy Robinson. Senator Blumenthal and other leaders, please excuse me if I become emotional due to this personal topic. In mid-March of this year, at the start of this quarantine due to COVID-19, My colleagues and I were faced with a very tough decision as family in-home providers. Each of us were faced with the harsh decision to close our homes and businesses in order to protect our families and the lives of the loved ones that we immediately care for. We made the choice to continue to open the doors of our homes to care for children whose parents are primarily healthcare and essential hospital workers. Many of my colleagues and I remained open. We made an undecisive decision. It was pretty much no turning back. So therefore, I sent from my personal home. I sent my teenage son to stay with a family member to prevent possible exposure of infection or a possible outbreak, which were the precautionary measures that I made, along with limited visits to my personal home, increased sanitization, physical distancing from parents, temperature taking for all children 3 times a day, and continual hand washing in order to serve essential workers and to continue to service the children of our community. However, many family in-home childcare centers, as it was described by Karen, providers chose to close their programs, some involuntarily due to compromising health conditions and family members with compromising health issues. Some of our family childcare providers have also been exposed or tested positive for COVID-19 and were therefore forced to close the doors of their in-home programs. Each day, providers are faced with the fears, the fears of risking our health and the health of those that reside in our homes, while also facing the uncertainties of loss of businesses due to increased attendance, again, which was so elaborately described by Karen. Decreased attendance and potential parent loss would also cause compromising, compromising outcomes to family childcare providers. While many of us are fighting to remain on the front lines for our community, our children, and our families, we need massive action, and we need massive support. Senator Blumenthal and leaders, we need your support. We need your support to ensure our sustainability, sound foundation, support in order for family childcare providers and other family childcare providers and other providers throughout the state, including center-based programs, to remain open and available to serve our community, workers, and most of all, the children that will shape our tomorrow. Thank you very much for this opportunity, and thank you for your time.
Tennille, thank you very much. You did a wonderful job. It's a difficult situation, so thank you so much for sharing your personal story.
Thank you.
You're welcome. Thank you. The next person we hear from will be Julie Clark, and she is the owner of a private tuition-based preschool in Waterbury. She does not receive any subsidies, and her center is closed right now. So Julie, go right ahead.
Thanks, Liz. So my name is Julie Clark. This is my story, and I think I represent many other childcare providers. As a single mother with 2 small children, I started doing childcare in my home in 1987. I now own a childcare center in Woodbury that serves about 200 families, from infants to elementary school children who come before and after school. In all these years, through good economies and bad, I've remained open, and that is until this March. By the end of March, I had 7 children in one day in attendance and 14 staff out of 33 who came to work because they needed their paychecks. And I rely 100% on private tuition. So the situation was completely unsustainable, and I closed my doors and I allowed my teachers to collect unemployment. I want to say a quick word about my staff and those in general who make it their life's work to care for and educate young children. You will not find a more dedicated and compassionate group of people. And even in a good economy, childcare providers cannot afford to pay them what they really deserve. So as of today, I am still closed. My parents are still worried about sending their children back. My teachers are still also nervous about coming back. Most of the childcare programs in the state of Connecticut are closed, and some of us, like myself, are considering reopening. But in the meantime, we have lost 4 months of revenue, and we're looking at higher expenses, lower enrollment, and a scarcity of PPE and essential cleaning pot products, which are also much more expensive than they were before the pandemic. Childcare in Connecticut and childcare in our country is an essential business, and we are businesses. We are often seen as just a lovely group of people who love children, and we are also that. But we are business owners, and we must, especially now, have the support of the federal government in order to continue to even exist. Childcare is the foundation of our economy. Without it, parents cannot go to work. Our economy depends on a sustainable childcare industry, and that means not just now, but also into the future. It's an issue that affects Democrats and Republicans. Our children, their well-being, as well as the industry that supports our economy, is a bipartisan concern. Thank you so much for being here and listening. Take care.
Thank you so much, Julie. That was very eloquent. And it truly is a bipartisan issue. We all work, we're all part of this system, and we need to pull together to make this work. I'm going to divert from the next two providers for one moment and let Senator Blumenthal have a few words. He has another meeting to get to. He has graciously been on another Zoom this week with us. So please go right ahead. We're so happy to have you here. So thank you.
Thank you very much. And just to let you know, my next meeting is with Governor Lamont and my colleague, Senator Murphy, and I am going to make childcare the #1 issue that I raise with them. Literally, the topic formally is supposed to be aid to state and local governments. But in my view, there is nothing more important than these numbers and these faces and voices that you have heard and seen today. I've heard them just a couple of days ago. I was very, very privileged and honored to hear Ava and Georgia, Julia, and Tennille, and others. Meryl, thank you for joining us again. And I was with Meryl just a day or so ago in New Britain. I've been going around the state. Today I'm going to be in Danbury. I've been in New Britain and Bristol and a number of other areas. But let me just emphasize that even if you care nothing for children, even if you are so hard-hearted and unhumanitarian that you have no feeling about the importance of early childhood education or care, think about the economic impact. We cannot reopen our economy. We cannot return to full employment. We cannot move forward with our schools reopening this fall unless we provide for childcare. And those numbers are absolutely chilling. To think that literally 45,000 spaces may be lost in Connecticut alone. 40% of our childcare facilities around the country in the next few months may close is just a national disgrace and scandal. Shameful. And we know the importance of early childhood education. We know the critical significance of childcare, and any rational person would look at these numbers and hear the voices of Tennille and Julie and others that you'll hear after me and say, no question, we have to move forward. Let me just say I'm going to be followed by a real champion in the House, Rosa DeLauro. Childcare is Essential Act. I'm a strong supporter of it. $50 billion is a great start, which is what her act would provide. The HEROES Act would provide about 7 to 10 billion. Not even a drop in the bucket compared to what's necessary. And yet, Mitch McConnell is saying, no, we need to pause. It's a liberal wish list, absolutely unacceptable. So I'm going back to Washington this Monday, and just as I am in the meeting that I'm going to be having now with Governor Lamont, I'm going to be putting childcare at the very top of my priority list and saying it is a moral imperative, it is a social and economic requirement that we move forward, that we make it a priority. It is, as Julie just said, and she put it so eloquently, it is a bipartisan imperative. There should be nothing about red or blue. You know, children don't go to red and blue early childhood or childcare centers. To see children, as I have in these last few days, enjoying the extraordinary important childcare services that they receive in Connecticut, the excellence, the quality is very inspiring. And I just want to thank everyone who's on this call for your continued very inspiring work. I'm going to be in this fight. We are in an epic battle, literally for the soul of our nation, and we ought to respect the profoundly eloquent and powerful voices and faces that we're seeing on this call. Thank you so much for letting me participate.
We would like to thank you very much for your continued support, for how you have listened to us, to our stories, and how you have recognized the true need in this area, and that it not only affects our children and our families, but it is also essential for our economy. So I will actually be in Danbury with you today, so I will see you later on today. And meanwhile, have a great conversation with our governor and with our Senator Murphy, and I'll see you soon.
Thank you.
Thank you. Okay. We're going to proceed with some more stories from the field. And next we have Ann Sousa from the YWCA in New Britain. She runs a large subsidized school readiness preschool program. So if you're ready, Ann, take it away.
I am, thank you. I'm very proud to be part of a group of advocates and early childhood leaders who are stepping up and having a voice for the children that we serve and the families that we serve. I'm coming to you right now from an empty room at the YWCA in New Britain. We have 336 slots. We have infant toddler, preschool, school age, and currently we have 78 as an enrollment number. The YWCA has been open since March 26th, serving the community here. However, we're starting to lose $100,000 a month, every month, and it is just not a sustainable program as we move forward. Many of the people who spoke prior to me were very eloquent and articulate in sharing all of the problems and challenges that we currently face. We are at an extremely reduced capacity, and we are unsure of what that will look like moving forward when the school district opens. We're unsure of how we're going to serve our children who have IEPs or IFSPs. So I really appreciate that everybody has been coming together to speak out for the children of Connecticut and our nation. Thank you.
Thank you so much, Ann. That is wonderful, and I know that program well. Tracy Madden-Hennessy has been fabulous in that role. I'm sure you will be as well, and it's a great program. So thank you so much. And we have now, so why does this matter? And what is the underlying, what are some of the underlying issues around where we find ourselves now? We have Georgia Goldburn with us. And Georgia is frankly, she has been speaking nationally as well. She is a strong voice for the early childhood community in Connecticut and nationally. And so, Georgia, we welcome you, and please tell us why this matters.
And thank you, Liz. Thank you all for sharing your voice. We see each other every week, and it matters for all of the reasons that were stated previously by providers. As Liz shared, I am Georgia Goldburn, and I also have a childcare center in New Haven, but I have a second hat, which is my role as a co-founder of Circle, which is a network of childcare providers of color in the greater New Haven area. And one of the things that was shared with you in the slide by Karen was that a large majority of the childcare industry is really supported by women and also by women of color. And what we also know about Connecticut, sadly, is that Connecticut is really very segregated. We know about the segregation in the schools, but in the early care realm, it's also segregated. And the majority of children of color and families of color really are supported by providers of color. Providers of color are there in the community where people of color live, and so naturally they're the ones that are there. And so as a woman of color, a provider of color in a community that is predominantly of color, I am experiencing this whole, in several different realms. I'm experiencing not only the crisis in the childcare, but I'm also experiencing the convergence of Black Lives Matter, the health disparities that are exposed by COVID, police reform, racial equity, and justice. And what is scary to me is that if we are going to strive to address any of those issues, we cannot do any of those things without a strong early care system, which is on the brink of collapse. 18% of childcare providers existing next year should give every single person here pause. It's chilling. And what COVID has exposed is a disproportionate impact that all of these systemic problems have on communities of color. And so when I am thinking about 18% of childcare centers existing, I know that as a result of this COVID crisis, this is going to have a perverse, and this is what COVID has been, it has a perverse impact on communities of color. And this will also just be another one of a drop in the bucket of how communities of color will be disproportionately impacted. Tennille shared with you that she's a part of Circle, and Circle shifted into high gear to ensure that one of those structural inequity, which is people that are historically unbanked or not valued in the banking system, would take advantage of the PPP loans that are there. And we were instrumental in securing over $250,000 for childcare providers in New Haven. All of them providers of color, and they have those bridge funds to get them from point A to point B to the next step. But in looking at the numbers, there were only 479 programs in Connecticut that received funding between $0 to $150,000 in PPP funding. And that's where the majority of our programs are represented. And when you look at the numbers nationally, only 23 to 25% of centers receive childcare funding through the PPP program. So that means about 75% of programs across the nation did not receive funding. And we know that because of those historical structural inequity, that more likely than not, providers of color, centers of color are vastly represented in that 75%. And so when we are talking about addressing these structural disparity, we cannot do that without a strong early care system, because the research is clear and it's resounding, and we have all seen it in our sphere, that a high quality early learning experience is instrumental And for me, it is my strategy in completely derailing that school to prison pipeline. And this is why it is so important to preserve those providers of colors in communities of color. We have to have strong communities of color. And if we are losing businesses that support people going to work, it just have a multiplying effect on communities of color. And we know those outcomes are not going to be good. We've been hearing a lot about Black Lives Matter, and I would contend that Black lives cannot just matter when it's about to be snuffed out at the hands of a police officer. It has to be, the sentiments and the principle of the Black Lives Matter movement has to be enshrined, and it has to be operationalized in high quality early care system so that we can change the trajectory of those Black and brown boys and men from the path of a police officer that may take their lives. And I don't want this just to rest in the realm of Black and white, because it's, as everybody said, this is not a red issue or a blue issue, and it's not a Black or a white issue. It's an American issue. In 1972, Nixon had an opportunity to create an early care system, a universal early care system for the country, and he walked away from that opportunity. And what was left is an early care system that has devolved into what we have here right now. And I suspect that it was easy to do that because at the time, the view of who would benefit from this system are poor people and communities of color. But what COVID has exposed, in addition to these structural inequities, is that the early care system is now instrumental in undergirding all of these other businesses. There was no way for Connecticut to respond to the health crisis without childcare centers there. And this childcare industry moved really very quickly to establish childcare facilities, converted childcare facilities to serve healthcare workers. And so to the extent that this is not just resting in the realm of communities of color in terms of the disproportionate impact that it will have, it really does affect us all. Had we had a high quality early care system started in 1972, we would not be contending with some of the structural issues around race and injustice I contend at this particular time. So that from my lens is what I have been sharing with folks, not only locally, statewide and nationally. And I don't feel that I even need to share it because when I speak to so many people across the state, I not only am appreciative of how lucky Connecticut has been in having a governor and a commissioner who is committed to this work and legislators who are committed to this work, no greater one than Representative DeLauro, who's also on the call, and absolutely Senator Blumenthal. But it was shocking, and it's sad that in spite of the fact that we are lucky and blessed, we are faced with so many issues in our system that it is scary to think about what's actually out there at the national level. I am optimistic because we are at such a critical point that I think that the country and the nation is going to have to respond because we are really on the brink of collapse. And so I feel that we're going to have to respond. And so in the sense that COVID has really created a really terrible situation, it's also created an opportunity to build once and for all a system that is designed to work for everyone and to create and to produce good outcomes, not just for people of color and communities of color, but for every single person. $50 billion is a beginning step. I think this is time that we now look at how we truly invest in this system that is now essential and critical to our economic future, and not just the economic, but the security future of this country. So with that, I just turn it back over to you, Liz. Thank you so very much.
Georgia, wonderful. Thank you. Such a compelling and thoughtful such compelling and thoughtful words. I think that we all have something to think about. And I also agree with you that the system was damaged before and precarious before COVID. This has just exposed the scars, the wound underneath. And going forward, we're going to need to really look at the long-term viability of childcare in Connecticut and across the country. The next person that we are going to be listening to, we've got one more person from the field, Queen Freelove from CSEA-SEIU, the Child Care Union. And then we will hear from Meryl Gay from the Early Childhood Alliance. And finally, we will have some remarks to close it out with Ian Rosa DeLauro. So go right ahead, Queen.
Good morning, all. Hi, my name is Queen Freelove, the Child Care Council Union President. And I would just like to say today that the funding is very important for the well-being of family child care centers and for parents. Parents cannot afford to make these payments without the funding. We are trying to secure for the parents. Parents are overwhelmed, trying to stay safe during the COVID. Parents are also afraid to send their children out. However, in order for them to work, they must have faith in the provider, in the center, and in God to send their children out for care. They are not able to work if they don't have anyone to care for their children. As Georgia said, this should have been done a long time ago. We have the opportunity now to stay together, fight together, and win this thing and make a definite change where childcare is first and foremost. Childcare is very important because without childcare, parents cannot go to work. Providers will not have an income, and centers will also be closed. These things are very critical for the well-being of society. In order for us to go to work, someone has to be there to care for our children. And that is the job that we do. But the funding will help keep our centers and in-homes safe and healthy, because as of right now, we're using more paper products trying to keep germs down than ever before. Those things cost money. And without funding, it can't happen. So let's all stay together, fight together. Let's get this thing right. Let's keep talking to our senators, our legislators, keep knocking on doors, making phone calls, sending out letters, because if we don't do these things, that change won't happen by itself. Thank you for listening and have a good day. God bless all.
Thank you so much, Queen. You know, thank you for also mentioning parents. Parents are a really important part of this. They will, many of them, be without care and without the support of the child care workers that support the whole family as well. Meryl Gay from the Connecticut Early Childhood Alliance is going to speak next. And then Meryl, can you introduce Rosa DeLauro when you're finished?
Absolutely. So you have heard from the field that the situation is dire. We are asking our representatives in Congress to put substantial funding into the child care industry to create a $50 billion dedicated stabilization fund for child care. 50 billion sounds like a number so big that none of us can really fathom it. But for Connecticut, that would be 330 million. That represents less than half a year of the revenue for the child care industry. We know that this pandemic is going to go on longer than 6 months. If we are really lucky, we'll have a vaccine by then, but it'll still take a long time for everybody to get vaccinated and to contain this virus. So we believe that it is absolutely critical that Congress act before we lose large chunks of the child care industry. We are thrilled to have Congresswoman Rosa DeLauro with us, who introduced the Child Care is Essential Act that put the $50 billion number out there, and I'm going to let her take over now. So Congresswoman DeLauro, a longtime champion of early childhood and children's issues in Washington, I'm going to turn this over to you now. And
thank you. Thanks so much, Meryl. It's such an honor to join with all of you and appreciate the opportunity to bring you up to date on what some of the things that are going on at the federal level. Let me just start by saying, I think that when Georgia spoke about systems collapse, I think what this pandemic has demonstrated that some of the, if you will, the social safety net systems that we thought were anchored and that were in place, though so many of us thought about how they were underfunded, et cetera. But what we have found that in the process of this pandemic, a couple of things. One is that the systems have collapsed. Now that is, you look at our unemployment system, the unemployment offices are overwhelmed. People can't get their checks for months because the system imploded. Take a look at the public health and our state public health labs and so forth. Antiquated technology, not enough trained personnel. We have no paid family leave in this country. We have no paid sick days. In Connecticut we do, but nationwide we don't have it. We are looking at our nutrition programs, which are not adequately funded in order to meet the need of people, and no one in the United States should go hungry. We have an abundance of food. But these are pieces of a social safety net that are in place, but in no way, and the pandemic has demonstrated the unbelievable shortcomings. And equally true and importantly, what has happened with the child care industry. At the same time, where the systems collapse have occurred, we are looking at the inequities that the system has uncovered, the racial inequities, whether they are with regard to health, to criminal justice, or economic disparities. So that when people talk to us about going back to normal, we cannot go back to normal. What we need to do is to be responsive to, yes, to the short term, but to the long term of what has happened and the issues that we have to try to address. And I will make this one point to you because it's not been mentioned, but this is a critical issue. If you look at underlying all of these pieces, it is about, and this is not the topic here this morning, but what underlies all this is families' inability to cope with the economic insecurities, and what is that effect on children? Enormous effect on children. And I just want to say, because I'm getting something out today, lost jobs and wages, lost food security, lost paid family leave and paid sick days, lost childcare, lost 5 days a week of in-person school, lost learning, lost socialization, lost healthcare and extra supports that are delivered through our schools, lost safety that comes with being at school and out of the home during the day, lost school breakfasts and lunches. And to that issue, another time, we will talk about a child tax credit and expanding the child tax credit to the families who are in need today that could take advantage of being able to cope with these difficulties. Now, let me just get to the child care industry. And Meryl, we've had a number of occasions. We've gone back, to March, I think, where we first started to talk about providers. Let me just give you a little bit of a snapshot. In 2017, in the Labor Age Appropriations Bill, we appropriated $2.4 billion, the largest increase ever in the history of the program. 2018, $5.2 billion, 2019, $5.2 billion, and in 2020, $5.9 billion for childcare, beginning to understand how critical childcare is. Now, the stories Tennille and Julie, Georgia, Queen, your speaking up is so critically important, and it is a bipartisan issue. I want to give you one more fact before I say some things about the legislation. And I have supported these efforts because we know that we had our business community going under. So we said, okay, we're going to do something with PPP, billions of dollars. And we said, okay, let's move forward. $58 billion to the airline industry. Okay, there's 100 in the HEROES bill, and by God, my hope is that they take this, that they take us to where the HEROES bill needs to be in terms of $170 billion that is in that in the CARES legislation, that, and we remove it in HEROES. In the CARES legislation was $170 billion tax break to hedge fund managers, 43,000 individuals getting $1.6 million in a tax break. They go back to 2018 and 2019 when there was no coronavirus. It's immoral. And my hope is that there will be the tenacity in the House and in the Senate, because in this House we passed it. So we need the Senate to say, let's take that out of there. So because we have other priorities. And if we could do these things, why aren't we now doing something about the foundation of a child care industry that is at the center of our economy? And without a child care industry in place, we will not be able to reopen our economy and get it back on track. In the CARES bill, we did put $3.5 billion. In the HEROES, $7 billion. No way is that enough money, which is what, and we know from the National Women's Law Center that it takes about $9.6 billion per month to keep current child care providers in business. We have a crisis and we need to respond to it accordingly. If we cannot make families feel that their kids are going to be safe and secure in a child care setting, the economy will never get back on track. And Merrill made a very, very good point. We got $50 billion in there. And I'll tell you what it's for in a second. However, so much of which will go to be paying past occurrences with shortfalls. So probably not enough to get us to where we're going. Not probably, not enough to get us to where we need to go, which is one of the reasons why I introduced, which is an emergency appropriations bill, $50 billion to address this crisis. I did this along with my colleague, Congressman Bobby Scott, and with Senator Patty Murray. This would exist within the Child Care and Development Block Grant. It's grant funding to child care providers to stabilize, understand, stabilize the child care sector. What does it do? We've got, it's for operating expenses and getting funds out quickly. It gives providers the ability to continue to pay staff, to provide tuition and co-payment relief for working families, promote health and safety because you have to comply with the public health guidance, prioritize providers that serve underserved populations, and that we want to make sure that the grants are awarded equitably across the child care settings. And look, you know this, I know this, but the Washington Post on July 4th, I believe it was, had an article that says, and I'll quote it, "Lack of childcare slowing recovery. Working parents are swamped at home. Productivity slump pinned on school center closures. The childcare crunch triggered by the pandemic has rapidly become a crisis for many workers and companies that is hindering the economic recovery. It disproportionately hurts women, and it threatens to leave deep scars for years to come. So, look, this bill is going to come to the floor of the House in a couple of weeks, okay? I am imploring you with your, not only your Connecticut network, but your nationwide network, that yes, it will be passed in the House, but we need your voices loud and clear to make people understand the strength of the legislation. And then you've got to get to the Senate. You got to be nationwide, all over the United States Senate. You know our guys, you know Dick Blumenthal, who was on, and you've got Chris Murphy, and Chris and I have introduced legislation with a tax credits for childcare for, I can't tell you how many years. But you've got, these are the people to get to. You have to overwhelm them in the same way that the hedge fund managers do, that the airline industry does, that the restaurant association does, because, excuse me, they're not going to listen to, if you're silent, your voices are not going to be heard. And this is the most important crisis that we have and that we should be acting on. So look, I don't have to tell you about what childcare does for families. You know it. You deal with it every single day. You're small businesses. You operate on a razor-thin margin. You talked about the 47% already closed, what could shut down. And a lack of childcare has been cited, I might add, as why women are still highly reflected in the unemployment rolls. You want to talk about a society today? There was an earlier article in the Post about essential workers. Essential workers are women.
I'm having trouble hearing you.
Essential workers are women. Childcare workers are women. My friends, I'm looking at all of the people here. I heard from Meryl, we heard from Dick Blumenthal, but the folks I'm looking at and the stories being told are by women. We need to have them respect, dignify, and trust the women who are dealing with this issue every single day. And not just give lip service, not just take a picture at your local child care center with kids. That is, in terms of Catholic parlance, posing for a holy picture. Let's put the money where your mouths are and where your picture is, okay? And look, it is also an issue, this is an issue that addresses racial inequality, as Georgia and others have pointed out. You've got Center for American Progress. They published their report, State of Child Care, especially for African Americans, highlighted minority communities. They talk about, I'll bet you've heard of food deserts. This article talks about childcare deserts. In affluent communities, the centers are there. They are not in low-income communities. They're not in Black and brown communities. You know, we have seen also that some of the folks who are small business people, minority small business folks who've applied for the PPP loans were unable to get them. That first tranche went out to the bankers' favorites, their preferred customers. We got to take back the system, my friends. And I will end with this. Childcare is essential for our economy, for our parents, for providers, for employees, And it's mostly about our kids. It's about our kids. You know, they will lose out. We know what preschool and childcare has meant to the development of our kids. We are not going to go back. That's why we have to yell in this period of time. It would be that we shouldn't have to fight for childcare. But that's where we are, my friends. And you play with the hand that you are dealt. So all of us, you've got my word. I will speak on the floor of the House in the next 2 weeks. I've been talking to the Senate. I've been talking to the House leadership. And I'm talking now to all of you. Get on the phone, email. You know, nothing focuses the mind like a death sentence. All of us are up for election in a very short period of time, my friends. You know, you're not with us. We are not with you. We'll go with those who want to help to make a difference for our kids and the work that we do for our kids. So thank you. Thank you for your comments, for the eloquence of your statements, for your courage in speaking up. And you know I stand side by side you. So God bless you. Thank you so much.
Whoa, that was fabulous. There is nothing more to say than that. You have been such a champion, Rosa, for children, for families through so many issues, but you are a blessing to our state, and we just every day are thankful that you are there. So thank you so very much. And with that, would like to know if there are any questions. I think there are folks looking to see if you can put them in the chat, or we can look to see if you have a hand raised. I'm just looking around to see if there are questions here that folks would like answered. Meryl, is somebody looking at them for the
yeah, I know that we have a lot of competing events today, and that there were press who were recording this event so that they could multitask. And so if there are press who are watching this video later, you can reach out to the Alliance, and we can put you in touch with any of the speakers if you've got questions for them. Thank you all for being here for this, and we will be continuing with our advocacy around these issues. Watch the Early Childhood Listserv for information about what's going on, and let's keep fighting.
There will be actions that we'll be asking you to take. We are coordinating and getting some of the tools that we have available to make it easy for people to do some federal advocacy. So be watching in the listserv. Okay. Thank you all very much, and have a wonderful afternoon.